Dear friends, welcome back. Now, after completing about the white matter in neuroanatomy, now the next thing that we have to learn is actually gray matter. So if you just recall, in the white matter, we have divided them into three categories. That is association fiber, commissural fibers, and then the projection fibers. Now, similarly, when you study about the gray matter, majorly we can divide them into two categories. The gray matter on the outer part of the cerebral hemisphere is cortex, cerebral cortex, and the one on the inner side will be actually forming the basal ganglia. More appropriately basal nuclei. I'll teach you about that later on. So first of all, we'll actually concentrate on the outer part of the cerebral hemisphere, that is cerebral cortex. And what do you have in that? In that, you'll actually have particular specific areas which are known as the Brodmann areas with specific function. Now, as a medical student, what you have to do is you need to just focus on three things in Brodmann areas. First, planning is important, guys. Okay. So in Brodmann areas, you have to just focus on three things. Number one, the name of the area. Number two, the location of the area. And number three, yes, the number of that. Brodmann areas are represented by specific numbers. So name, number, and location. So how we are going to plan this topic is, first of all, we'll draw the diagram. And in the diagram itself, I'll tell you the exact location where those areas are located. Then later on, we'll write on the notes regarding that one. And that will be the best way to learn, guys. Okay. So let's start with all the Brodmann areas. That too, first of all, on the superolateral surface of cerebral hemisphere. So for example, you are looking at the superolateral surface. I hope you remember. If this is the cerebral hemisphere in coronal section, hope I don't have to tell you this diagram again and again. You already know that we have discussed a lot of topics with the same diagram. So if this is the coronal section of the cerebral hemisphere, we know that cerebral hemisphere has got like three surfaces. One will be the medial surface, another the inferior surface, and this one here will be the superolateral surface. And right now we are dealing with the superolateral surface. So whatever diagram I have drawn there, that is the superolateral surface. Now on the superolateral surface, let's first begin with the temporal lobe. In the temporal lobe, we'll actually have like two sulci. And now it's not even like something anatomy or something great knowledge that you require, guys. Simple, common sense. If you're having like two sulci, there'll be how many gyri? There'll be like three gyri. Okay. So it's common sense, guys. In the temporal lobe, suppose if you're having like two sulci, then how many gyri do you have? You'll be actually having like three gyri. So if you're having like two sulci, two depressions, there'll be three elevations there, three gyri. And what will be the name of these gyri? They'll be temporal gyrus. So let us write down the name of this one. In short, there will be superior temporal gyrus, and this one here will be the middle temporal gyrus, and finally this one here will be the inferior temporal gyrus. Guys, don't worry about the full names and all. As I promised you, we'll write down that in the notes. So right now, just draw the diagram neat and clearly along with me. So I repeat again, in the temporal lobe, you have got like two sulci, two depressions. Obviously, there'll be three gyri. Superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. In the superior temporal gyrus, you'll be having area number 41 and 42 here. And that will be actually the primary auditory area. So primary auditory area, that is the name of the Brodmann area. What is the number of that? 41 and 42. And where it is located, superior temporal gyrus. As I said you in the beginning of the topic, your focus should be on these three things. Next, just posterior to that, in the same superior temporal gyrus only, just posterior to that, there will be area number 22 here. And that area number 22 is nothing but auditory association area. So there will be a primary auditory area and then the auditory association area, guys. Now after temporal lobe, welcome to the frontal lobe. And exactly the same story in the frontal lobe also. In the frontal lobe, again, you'll be having like two sulci. If there are two sulci, there'll be like three gyri. But what will be the name of these three gyri? Frontal gyrus. So there will be one superior frontal gyrus, and then there will be middle frontal gyrus, and then there will be one inferior frontal gyrus. Superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. Now out of these three, remember inferior frontal gyrus, extremely important. It can be again divided into two areas with the help of like this small sulci here. It can be divided into two areas. One will be like pars opercularis and pars triangularis. In pars opercularis, we'll be having area number 44 and area number 44 will be present in the pars opercularis, and area number 45 will be in the pars triangularis. Whatever it is, both of this together, 44 and 45 are referred to as Broca's speech area. We'll write down later, don't worry about that. 44 and 45, both of them are together. Broca's speech area located in the inferior frontal gyrus. Located in the inferior frontal gyrus, guys. Perfect. Now after this, the one sulcus which every medical student knows very well, a prominent one, very clearly seen and very prominent one, guys. That is the central sulcus. So this sulcus is referred to as your central sulcus of Rolando. If you are interested in learning the complete name, it is central sulcus of Rolando. Now again the same thing, apply common sense. If it is a sulcus over there, on either side what do you have then? Again gyrus. If it is central sulcus, there will be a gyrus on this side and there will be a gyrus on the other side also. What is the name of that? Very simple, pre-central gyrus, and then there will be a post-central gyrus. So in front of this, in front of the central sulcus, this one is referred to as pre-central gyrus, and behind that there will be post-central gyrus. Post-central gyrus. Now what is the area, what is the Brodmann area present in the precentral gyrus? In the precentral gyrus, you'll be having area number 4 there, guys. Area number 4, which is referred to as the primary motor area. Primary motor area. And I hope all of you remember, we have already discussed in the neuroanatomy, the motor function will be mainly controlled by your pyramidal tract. And yes, the pyramidal tract fibers are going to begin from here only. I have already explained you that in the topic of tracts. Pyramidal tract fibers will be originating from the primary motor area, area number 4. But something more interesting now. Right in front of the area number 4, there will be area number 6 also. But let me tell you like more in depth, more clearly. The area number 6 is present in all the 3 frontal gyrus. I mean to say the superior frontal gyrus, as well as the middle frontal gyrus, as well as the inferior frontal gyrus. So area number 6 will be present in all the 3 frontal gyrus. The superior, middle and the inferior, but not occupying the entire thing, only the posterior part of that one. So let me put it properly here. Area number 6 is actually referred to as premotor area. Primary motor area is area number 4 only. Area number 6 will be the premotor area, and that premotor area is present in superior frontal gyrus, middle frontal gyrus and inferior frontal gyrus, the posterior part of that one. Hope it is very clear. And yes, which fibers are originating from here? Extra pyramidal tracts will be originating from here. So primary motor area number 4, that will be pyramidal tract, whereas premotor area number 6, from there extra pyramidal tract fibers are going to originate from there. Now once you are done with this one, we can include one more thing here. There will be area number 8, and area number 8 is actually located in the middle frontal gyrus only. What is the number of the area? Area number 8. Location, it is located only in the middle frontal gyrus. And what is the name of this one? Remember, that is the frontal eye field area. The frontal eye field area, important one, has been already tested in your exam. And just to revise you again here, don't worry about writing the notes, guys. We are going to make the notes properly here. First, I want you all to understand the location of this one and get set ready for the image-based questions if they are asked in the exam. Now, after completing the temporal and frontal, let's go towards the, behind the central sulcus. What do you have? Post-central gyrus. In the post-central gyrus, you have got area number 3, 2, 1, 3, 1, 2. Area number 3, 1 and 2, and that is located where? In the post-central gyrus. What is the name of that area? That is primary sensory area. Primary sensory area, area number 3, 1, 2, located in the post-central gyrus. Now welcome to the parietal lobe. In the parietal lobe, you have got only one sulcus, and I hope you have understood till now with common sense how to deal with this one. If there is only one sulcus in the parietal lobe, how many gyri do we expect there? 2 gyrus. One is superior parietal, another one is inferior parietal. But you have to be a little bit careful here. It is not known as gyrus here because it is more bigger. Okay. So when that gyrus, that elevation becomes more bigger, it is actually referred to as a lobule. So better we call it as superior parietal lobule and inferior parietal lobule. By the way, sir, which area do we have here? Remember, in the superior parietal lobule, you'll be having area number 5 and area number 7. In the superior parietal lobule, you'll be having area number 5 and 7, and that will be sensory association area. Okay. So I repeat again, primary sensory area will be area number 3, 1, 2. Sensory association area will be 5 and 7. Then apart from that, yes, you also have like 2 more gyri here. And this gyrus here you'll be actually having area number 39 and area number 40. And area number 39 will be actually present in the angular gyrus, whereas area number 40 will be present in the supramarginal gyrus. Supramarginal gyrus. And together they are going to form the Wernicke speech area. Very important one. Okay. So one is Broca's speech area 44-45 and then the Wernicke speech area. I'll tell you what is the difference between these two guys. Hope it is extremely crystal clear right now. So now what we are going to do is we are going to make a table where we are going to write down the name of the Brodmann area, the number of that and location. Let's begin right now, sir. So first of all, what will be the name? We'll deal in the same order, guys. First one that we have studied is the primary auditory area. Primary auditory area. Now what is the number of the primary auditory area? Area number 41 and area number 42. What is the location of that one? The location, remember, it's located in the superior temporal gyrus. Superior temporal gyrus. Now I want to include like one more point here, which was actually tested in your exam. That area where you have the primary auditory area, that is actually also referred to as Hessel's gyrus. That is also referred to as Hessel's gyrus, and that was asked in your exams, guys. There is a specific name given to that one. Number 2, auditory association area. There is an auditory association area, that area number 22, and yes, it is also located in the superior temporal gyrus, just posterior to the primary auditory area, guys. So we are comfortable with the auditory areas. Next one now. The primary motor area. The primary motor area, area number 4. And where is that area number 4 located? Right in front of the central sulcus, in pre-central gyrus. Pre-central gyrus, that is the location of that one. If this is the primary motor area, then what about the premotor area? The next one, premotor area, that is area number 6. I told you primary motor area is actually for the origin of the pyramidal tract fibers, whereas the premotor area number 6 is actually for origin of the extrapyramidal fibers. Now where it is located? This is something interesting. Remember, it is located in all the 3 frontal gyrus. Superior frontal gyrus, not only superior, even the middle frontal gyrus, and then even the inferior frontal gyrus, guys. So superior, middle and the inferior frontal gyrus only in the posterior part of that one. Once you are done with the motor area, the next one is Broca's speech area. Now Broca's speech area, guys, I told you that will be area number 44 and area number 45. But I want to be like more specific here. The area number 44 is actually located in pars opercularis area, and the area where you have the area number 45 is referred to as pars triangularis. Pars triangularis. You have to be very much specific about that one. By the way, where do you have exactly present these two areas, sir? 44, 45? Whatever pars opercularis and pars triangularis that I am telling you, where is it located? In which frontal gyrus? They are located in the inferior frontal gyrus. Inferior frontal gyrus only. Now after this Broca's speech area, let us do in combination here. I told you one more, that is Wernicke speech area. Wernicke speech area. Now what is the number of Wernicke speech area? Remember, it will also include 22 and then 39 and then 40. Area number 22, 39 and 40, guys. Or better, I'll do one thing here. I'll just write it like this here. Area number 22 and then 39 and 40 will be the Wernicke speech area. Now once you know the number, let's see the location. I hope I don't have to tell you about the area number 22 again. It is located in superior temporal gyrus only. Superior temporal gyrus only. Then area number 39 will be actually referred to as angular gyrus. Angular gyrus. And area number 40 will be the supramarginal. That is supramarginal gyrus. Awesome. Crystal clear. Now here, don't get confused between area number 22. Don't think that, sir has included that in auditory association area and even in the speech area also. Of course, there should be some relation. There are certain fibers which are connecting the speech area with the auditory area. There is an association between the speech area and the auditory area. That's the reason why that area is actually overlapping. So area number 22 It's actually auditory association area, and even it is a part of your Wernicke speech area. Don't get confused over there. Now, once you are done with the name, number and location, then sir, why do we have like two speech areas over here? Why do you have like two speech areas? What is the difference between these two? Now remember guys, the Broca speech area, it's actually the motor area, and the Wernicke speech area is actually the sensory speech area for understanding, for comprehension of the speech. Okay, so Broca speech area is actually the motor one, and the Wernicke speech area will be the sensory speech area. Now, once we are done with the auditory areas, we are done with the speech area, we are even done with the motor areas, guys. Let's go towards the sensory areas. In the sensory area, I told you there will be a primary sensory area, and primary sensory area will be area number 3, 1, 2. And that is located just behind the central sulcus in the post-central gyrus. So the primary sensory area, area number 3, 1, 2, it's located just behind the central sulcus in the post-central gyrus. Whereas sensory association area will be the area number 5 and 7. The area number 5 and 7. And that is actually located in superior parietal lobule. I hope you all remember. I told you very clearly, gyrus, when it is a bigger one, it's a larger one, it's no more referred to as gyrus, it will be actually referred to as lobule. Superior parietal lobule will have area number 5 and 7. That is the sensory association area. So in this manner, we are done with the sensory area, the motor area, the auditory and the speech areas with their name, number and location. Now sir, what about the visual areas? In the visual area, this is like something very famous one which every medical student will be knowing. There will be a primary visual area. That is area number 17. And then you have a visual association area. That is area number 18 and 19, guys. So primary visual area will be 17, whereas the visual association area will be 18 and 19. And all these are actually located where they are present in the occipital lobe. In the occipital lobe, there will be a sulcus which is referred to as calcarine sulcus. Very important one. Around that calcarine sulcus, like concentric circles, you have area number 17. Around that there will be 18 and then 19. And I'll show you that in another picture, on another image, guys, where we are going to see all the areas on the medial surface of the cerebral hemisphere. So just now, whatever diagram that we have drawn, it's actually the superolateral surface. Now let us see the medial surface. So let's draw one more diagram here, guys. The medial surface of the cerebral hemisphere. And I hope you all remember what is the prominent thing on the medial surface, sir. The moment you see the medial surface, how will you be able to identify that one? Corpus callosum. So let us draw the diagram here. So that's the cerebral hemisphere. And this time, guys, we are looking at the medial surface. So medial surface of cerebral hemisphere. Now, what do you have on the medial surface? Let me tell you all the important points that are that you have to learn here. First of all, when it comes to the occipital lobe, in the occipital lobe you have a sulcus that is actually referred to as your calcarine sulcus. This is calcarine sulcus. Now, what is the importance of this calcarine sulcus? I'll tell you. Normally, what is the visualization in our mind when you say sulcus? Sulcus is just like a depression. But here, this sulcus, yes, it is like a depression, but it's not like a normal depression like this. It's like an axis. It's entering into the occipital lobe. For example, like my pen here. So the calcarine sulcus will enter into the occipital lobe there, like an axis. And because it's like an axis there is an area around that 17 and then around that 18, around that 19. So that's what I'm trying to tell you. Area number 17, 18 and 19 are like concentric circles. So this is 17 here, around that 18 here, and around that there will be 19 here. And we all know very well 17 is primary visual area, whereas 18 and 19 are visual association areas. No need to write down again. Now once we are done with the visual areas, now the most important thing here, there will be a prominent sulcus here. And this sulcus is referred to as your cingulate sulcus. And in the upper part, what is going to happen here, that cingulate sulcus will be dividing. So let me first of all write down the name here, guys. This one will be the cingulate sulcus. Cingulate sulcus. Now you got to understand a little bit here. Try to understand here, guys. Focus. Look at me here. So for example, this is the medial surface of the cerebral hemisphere. Then there will be superolateral surface and there is an inferior surface. Fine. Just now on the superolateral surface, I told you there will be one prominent sulcus here, central sulcus. Now that central sulcus, which is present on the superolateral surface here, it's even extending onto the medial surface. It's simple to understand. So there's a central sulcus extending onto the medial surface also. And that you will be able to actually appreciate here. It's the central sulcus, which is extending from the superolateral surface towards the medial surface. Now you might be thinking, why I'm stressing a lot here? Because it is a central sulcus, whatever area that you are able to appreciate here is referred to as paracentral area or paracentral lobule. Para means around, you know. So paracentral lobule. Now what is the importance of this paracentral lobule? It was recently asked in the exam. Remember, it is the highest center which is actually controlling the micturition and defecation. So the highest center in our body which is actually controlling the micturition and defecation is actually the paracentral lobule, guys. That has been recently asked in the exam. Take care about that. Now, if this is the cingulate sulcus, if you have a sulcus, definitely there will be a gyrus. Yes, this gyrus is actually referred to as cingulate gyrus. This is cingulate gyrus over here. And apart from that, on the other side, you also have parahippocampal area. So this area is actually referred to as parahippocampus. Parahippocampal area or simply parahippocampus. Now this parahippocampus and cingulate gyrus, these two are actually connected here with this area here, and this is referred to as isthmus. This area is referred to as what, guys? Isthmus. So you can just remember that the cingulate gyrus is connected to the parahippocampal gyrus with the help of that isthmus over there. And then what about this area? This is referred to as uncus. And what is the importance of this uncus over here? Uncus is actually the area number 28, and that will be your olfactory area, the primary olfactory area. Uncus is nothing but the area number 28, and that is your primary olfactory area. That is one point clear over there. Now last two more points that you have to remember here. Right in front of this one, corpus callosum, you'll be able to appreciate two more areas over here. That is your para-olfactory area. Now don't think that I'm telling you like so many names over here. Just wait for a second. There is a beautiful conclusion over here. Para-olfactory area, and even this area is referred to as para-terminal area. This is para-terminal area. Now try to appreciate one thing here. All these areas which are actually surrounding the corpus callosum. So this here is actually the corpus callosum, and try to appreciate all the areas around the corpus callosum, guys, in sequence. So we have got the para-terminal, para-olfactory, then there will be cingulate gyrus, isthmus connecting with the parahippocampal gyrus, and uncus. Remember, all these are actually the components of limbic system. All these are actually the components of your limbic system only. So let me just name them here or number them over here. So number 1, the para-terminal gyrus. Number 2, the para-olfactory gyrus. And number 3, the cingulate gyrus. Number 4, isthmus. Number 5, parahippocampal gyrus. And number 6, uncus. So all right from 1 to 6, whatever I have numbered here, all of them are actually the components of the limbic system, guys. That makes the things easier for us. So when you study about the limbic system, mostly it's a topic of physiology, neurophysiology. So there is a lot to study there. So in anatomy, my work is done here, telling you about all the anatomical structures of your limbic system, which are just around the corpus callosum over there, guys. Hope the things becomes easier here. So in one diagram, I have studied about the superolateral surface, all the Brodmann areas, and in the another diagram, the medial surface, all the Brodmann areas. And that brings our topic to the end over here. These are all the Brodmann areas that you have to remember. And I'll be ending this by telling you one thing here. In Brodmann areas, your focus should be on 3 things. Number 1, name of the area. Number 2, the number. And then finally, the location of the area. That will help you in solving almost every question in your exam, guys. Thank you.